Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight, it's our yearly Back to School segment to get you ready. Also, what is a hospitalist? Aging health care, how to help. And we also have a vascular surgeon to prevent amputations. That and Baptist Health Foundation is here. My first guest, Dr. Sarah O'Leary. You are a med-peds physician. You're one of the newest associates at Family Practice. Welcome.
Thank you, Dr. Fox.
So tell us, we do this every year, but there's always new things, and there's always some little nuances to going back to school. So what's some of the first things you ought to think about?
Yes, so back to school, sometimes we'll say back to school, back to doctor. Good to make sure that your child's had a checkup within the last 12 months, and if not, get that scheduled as soon as you can. There's several things we would go over during checkups. One of many is making sure they're up to date on vaccines.
Tell me some of the routine vaccines and maybe some of the new vaccines we need to pay attention to.
Yes, so most of the vaccines are given in early childhood and infancy, and then there's usually a little bit of a break until preschool. But if you have a preschooler or a kindergartner, you want to make sure they're up to date on their measles, mumps, and rubella, also known as MMR, their chickenpox, also known as varicella, and then there's a DTaP and a pertussis booster that we give with a polio booster around that age. So you want to make sure they're all caught up around kindergarten for those. And then there's another set that we give in middle school. So when your child turns 11 or starts 6th grade, we do a tetanus booster and their first meningitis shot, amongst a few other catch-up things.
There's also COVID this year.
Yes, and flu. Don't forget flu.
Oh, yes.
So we're still waiting on final recommendations from the CDC on boosters. But if your child has not had one in a while or has not begun the COVID vaccine series, it's important to get that started now, whether that's at their doctor's office or at a pharmacy that provides those vaccines for anybody 6 months and older.
Now, one thing I need to address a little bit, vaccines are safe. I mean, we have a lot of people that worry about them. You have a lot of stuff out there about vaccines, but generally they're good things.
They're very much so. So it's been said that sometimes the thing that kind of puts vaccines at a disadvantage is they're so good at what they do that we kind of forgot why we needed them in the first place. So they're very, very effective and very safe. Most common side effects are things like sore muscle, sore arm, or a low-grade fever, but make sure you talk to your doctor about any specific concerns.
And it's also important, not just vaccines, but to get the checkup. What do you kind of look for at the checkup? And is there a sports checkup different than a regular checkup?
It is. Sometimes they will be done at the same time, and sometimes it's 2 separate visits. Just depends on what else is going on. For young children that are not playing middle school or high school sports, usually just a regular well-child check is what we're talking about. That's an important time to go over their nutrition, their diet, if they're having any issues with their bowels or their bladder, their sleep schedule, as well as to check on their development, make sure they're doing all the milestones they're supposed to, how they're doing in school and socially. So we want to check on all those things as well as their safety. So we want to do that every year. And then a sports physical, we go a little more in depth on cardiovascular risk, especially in the family, any history of heart problems or sudden cardiac death, things like that we want to check for. And we do a very good cardiac exam and make sure there's no reason that the child couldn't safely participate in sports.
Okay, real quickly too. That's assuming you do all that, but you still manage to get sick. So you got a runny nose and a cough. What do you tell the parents? What do you tell the kids?
Yeah, so it's coming. The germs are already making their way back now that we're back to school and things are mixing. Most of the time it's nothing major to worry about. So a couple of days, runny nose, stuffy nose, cough, not feeling great is one thing. If the symptoms are severe, like trouble breathing or a fever that's lasting more than a few days, you want to make sure you see your doctor right away.
That's great information. We appreciate what you do. We appreciate you take care of the patients and getting everybody ready to go back to school.
Yeah, thank you.
All right, and if you haven't seen your doctor yet, now's the time to make your appointment so you can go back to school safely. We'll be right back.